Mr. Binks, we're really excited, aren't we? Yes. Why? Well, we're jumping on Zoom now to speak to the amazing Danish vet, Dr. Lise Hansen, all about the very latest guidelines to be issued by the WSAVA on the recommendations of spaying and neutering, and indeed highlighting many dangers to both of these procedures. I'm Anna Webb. Welcome to A Dog's Life. Dr. Lise Hansen, honestly, it's such a pleasure that you're back again. I love our podcasts.
Thank you. No, it's a great pleasure to be back. And I think we've got a really exciting and important topic today.
That we've talked about, in fact, already over the last 4 years. I think 3 times, maybe 4, which is this kind of dilemma. Do you neuter? Do you spay? Or don't you neuter and don't you spay? Now, you've just read the latest guidelines from the amazing WSAVA, the World Small Animal Veterinary Association, whose role is to guide and inform vets around the globe, I think, about best practice. So please highlight the most recent set of guidelines that are now available for everyone. That's not just vets, that's dog and cat owners as well, to read on the WSAVA website.
Thank you, Anna. Thanks for having me back again. Yes, absolutely. I mean, you and I have talked about this before. We've talked about the fact that the practice of neutering dogs routinely has turned out to be associated with some health problems in neuter dogs that we have 20 years ago, even 10 years ago, maybe, were just not at all aware of. And anyone listening who wants to know more about this, I would invite to go back in this podcast series, because we've talked about the mechanisms that are involved, and we've talked about the implications of living with intact dogs. So in that way, it's not new that neutering dogs is problematic. But what is completely new is these guidelines that I've got in front of me, the WSAVA guidelines for the control of reproduction in dogs and cats. And it's not only new guidelines, it is the first ever global guidelines written for vets about neutering dogs. So it's really breaking news, and they came out earlier this month. So it's only a couple of weeks ago. I've only just read them. This is 140 pages of very detailed discussion of this topic. I wouldn't suggest that dog owners read it. It's a scientific document, and there's a certain language to that, and it's really comprehensive. But well, if I may say so, that still the only place that I know where you can read about this as a dog owner is my book, The Complete Book of Cat and Dog Health. So if anybody wants to know more after listening to this, I would be as bold as to recommend my own book.
Well, I'd recommend it too. It's a very good book.
Thank you, Anna.
It's a very good book. It's in my eye line as we speak, actually. And a couple of my newest dog client people, they've bought the book. So it is back in stock, because the last time you came on,
yes,
it was so popular, it was sold out. But it's good news that it's back there and available. So
yes, it was sold out, and it took a while to get it reprinted, and then it took a while for it to appear as reprinted everywhere. But it is available again, and it is in fact on sale at 15 quid at Amazon at the moment. So that's certainly one place where you can get the information. And my point about mentioning that was also to say that book was published 4.5 years ago. So even then we knew about the harmful effects of neutering. But what is just groundbreakingly new, for lack of a better word, is that these guidelines now exist that very clearly spell out the best practice, what vets should consider, what they should look at, what they should recommend. So it's official, it's formal. And I think that's the important point to make, that it is no longer a matter of opinion or, professional assessment. It's not what each dog owner or each vet happens to believe or happens to feel about this. This isn't even a research document, and it isn't even a a meta-analysis, a summary of the research that's been going on. This is more than that. This is the six professors of small animal reproduction sitting at universities around the globe who have been asked to come together and go through all the research that has been done on this topic. They've gone through everything and they have collated it and they have turned it into their recommendation of best practice. So it really is where veterinary science is at the moment. This is what vets should be doing and should be saying. And if an individual vet is not, as of June 2024, if an individual vet, any vet who neuters a dog without having these discussions that are described in this document, they would be remiss if they didn't inform the owners of this. And that's the breaking news part of this. It is now official that this is what vets must say. The WSAVA website describes their role as supporting companion animal veterinarians, I'm quoting from their website, by setting minimum standards of care and recommending best practice. So what this document says is now officially best practice in terms of what we do about neutering dogs.
So what is it?
And that's big.
So Lise, yes. So what is it?
Yes, absolutely. Yes. What they do is obviously they go through, it's a very long document, and they go through all the different risk factors, all the different possible unfortunate effects from neutering dogs. And they discuss everything we know and everything we suspect and everything we need to look into more. And obviously in a scientific context, you can only say what's been demonstrated. So if a study has been done in whistlers, they can only say that's true for whistlers. They can't necessarily extrapolate to the whole dog population. So there's a lot of detail and there's a lot of nuances and there's a lot of areas that need further investigation.
Like what?
But what they are saying, well, what they say to begin with, if I can just start there.
Yeah. No, honestly, go.
Because they say it really well in their introduction. I think they say how this this request by owners, or this conversation that vets have with owners about neutering, they say it, I think it's a sort of slightly funny way, but it also sums it up well. They say it has, over the last decade or slightly longer, it has gone from the owner saying, spay my dog, please. That was just anyone, 15 years ago, maybe even 10 years ago, you'd call the vet, Molly's whatever months old, can we have a spay? Sure, come in next Wednesday. That was the conversation, please spay my dog. Then they say in the last decade, the conversation has moved from spay my dog, please, to at what age should I spay my dog? Because there has been this conversation emerging that spaying can have detrimental effects. And certainly in some parts of the world, that has been mostly focused on early spay. So the conversation there's been a slightly longer conversation with more questions, primarily the one about when should I spay my dog? And what they're saying is that with this document, as of June 2024, the conversation now moves on to why should I spay my dog at all? Or should I spay my dog? And well, as a spoiler alert, they are saying that it is best not to. But obviously, it comes with a long discussion about there's a lot of individual considerations to make about the owners and the dogs and the relative risks. How many dogs are in the household? How well are they supervised? What kind of dog is it? What is their lifestyle, etc., etc., etc. But there is certainly no doubt that of the health risks of neutering dogs. And one thing that they make very clear is that when anyone considers neutering, when anyone has that conversation with the vet should mention that sentence just is repeated over and over and over again. Should be mentioned, should be mentioned. You know, the vets should warn owners about an increased risk of a long list of problems that include cancers, lots of different types of cancers, for instance, mast cell tumors, transitional cell carcinomas. These are tumors of the bladder, typically. Osteosarcomas. There's a study that shows that if a Rottweiler is neutered, it doubles the risk of that Rottweiler developing osteosarcoma, so bone cancer. A study shows that Wieslers are 4 times more likely to get lymphomas if they are neutered. Increased risk for lymphomas has been demonstrated in golden retrievers as well. They talk about hemangiosarcomas, which are very nasty, deadly tumor of the spleen. The risk of developing a hemangiosarcoma, especially in female dogs, is increased 5-fold if they're neutered.
That's interesting. Well, it's just interesting hearing all of this. I mean, crumbs. I mean, apart from panicking awfully right now because my little Mr. Binks was neutered, you know, before I got him. So, and a lot of people right now will be listening with neutered animals.
Yeah.
It's interesting you mentioned bitches there, you know, because obviously spaying a bitch is technically more of an invasive type of surgery, isn't it? You know, than chopping the ghoulies off a boy. It's a longer process, and more skin gets cut, and more perhaps prone to infection or whatever afterwards. I mean, you know, I actually believed my vet the other day actually that, and I actually believed them. It's so funny about, you know, my cat who's still got his testicles, and said, Anna, you don't need to worry about a general anesthetic. We freeze them off now. And I went, what? You freeze them? And I realized I actually believed it. Can you believe it? It was a joke. I think. I don't think you can freeze testicles off, can you? I don't know. Anyway, he wasn't going to have that done either anyway. But anyway, that's another issue. And it's talking about cats, but which I know is contentious, that I haven't neutered him yet, but he's old, Lise, and he's got other things in my view.
And I think it is certainly an important point to make that every decision should be made on an individual basis. You know, each case should be looked at on its own merits. There can be arguments for, there can be arguments against. This report also covers cats, and they say as a general recommendation, their recommendation is that cats, male and female, are neutered. For 2 reasons, partly because neutering doesn't seem to have the same detrimental effect on their health in cats as it does in dogs, and also because intact cats, it can be difficult to have intact cats as pets, and there are a whole other, you know, there's lots of other risk factors to cats' health if they go outside and they're intact, and they're much more likely
I know that.
to have...
I mean, trust me, Gremlin was neutered, you know, but you see, going back to Gremlin, you know, when, you know, he got ill, and we all know now, you know, he was poisoned, but his symptoms were hypoglycemia. So sure, you know, obviously the obvious thing was to think he had diabetes. But anyway, he you know, it's all right. I think I'm in the 5th stage of grief now, acceptance. But in part of, you know, getting to his diagnosis and everything, anyway, one of the thoughts was he had cancer, lymphoma, you know. And then I was Googling lymphoma, and apparently you see in neutered cats, specifically neutered cats, are more prone to lymphoma. He didn't have cancer and he was neutered, proving that not all neutered cats will get lymphoma. He didn't have cancer in his body. So he was a neutered cat that didn't get lymphoma. So that was good. So, you know, maybe, you know, cats are just so much more difficult, aren't they, to assess, really. But yeah, I mean, with Baggy, yeah, I mean, I'll probably get him neutered. But yeah, he's interesting. But you see, the thing is as well with spraying, unless you neuter before they're 1, you know, neutering won't stop him spraying. That's called training, that will stop him spraying indoors, which we've done actually. He doesn't spray indoors anymore. It's a massive relief, because my house did, well, my flat did smell like a cattery. At times. I'd
Oh,
walk in. No, it'd be a nightmare. I'd open the front door and go, oh God, somehow this has to stop. You know, this is really bad. I can't have any visitors ever again. But no, that has got better, actually. It's a funny thing, but I think he's a totally feral cat, to be honest with you. I mean, I think I'm quite actually good with animals. He's great. There wasn't any room at any of the rescues. I wasn't going to keep him, so I was still hurting after Gremlin. He landed on my doorstep. I don't know where from. No chip. Rescues all full. What was I going to do? Chuck him out? I mean, I couldn't have done that because he would have died. He was very, very thin and not very well on a number of levels. So he's now okay, you know, and still alive, which is great. So that's my justification for having his testicles still on him at the moment. And this may change, but he's got this weird kind of skin thing going on. But that's fine. You know, the vet doesn't agree with me, but we're all entitled to our own opinions. And you know, and owners also, I think, you know, need to be valued for their opinions, because it does seem that spaying and neutering to me has become kind of, certainly in the UK. I mean, you've also, Lise, got to say this, that views on neutering is very, very different across the globe, right?
And
Like
absolutely, absolutely,
I
yeah.
mean, in
And in fact,
Norway,
this document from the WSAVA discusses that as well, and how in some countries neutering is illegal. In Sweden and in Norway, 98% of dogs are intact, whereas in America, which is I mean, UK is sort of in the middle. Most dogs are neutered in the UK, but there's also a reasonably large proportion of unneutered dogs. But in America, having an unneutered dog is really challenging. Just the thought of it is very alien to them. And I mean, one reason I'm just really excited about this document is that I find that when I listen to the discussion that happens at the moment among American vets, that they almost make it sound like we don't want to do the old-fashioned kind of neutering anymore. There's a different procedure. And what they're talking about is a hysterectomy, what we sometimes call an ovary-sparing spay, where you leave the ovary, so you still have a normal hormonal what do you call it, normal hormonal levels in the dog, but they don't have a uterus, so they can't become pregnant. And it sounds to me, and I'd love to be wrong, but it sounds to me like the Americans are sort of settling on that one as this is what we all need to do instead. And this document actually clearly says that that's not how we should think about it. What they say very clearly is that no intervention is recommended in most cases. That is their wording. And then they obviously have long discussions about when you may neuter anyway, when you absolutely shouldn't, the different options that there are. But the bottom line, after reading through this whole document, is that what they recommend is that no intervention is recommended in most cases. So most dogs would be better off being left intact. And can I just say, because there's another really important point, when we talk about, you know, I just mentioned, I think I don't know if I got to that yet, but, you know, if you have a Vizsla and it had a hemangiosarcoma, if you've had a Vizsla and it had a hemangiosarcoma and it died, and with that particular disease, it's often a very dramatic, very shocking, very sort of, yeah, just emotionally traumatic. It's often very sudden, and once it's discovered, there's nothing you can do, and it's a nasty, nasty disease. And we now know that for a Vizsla particularly, that is 10 times more likely to happen if that dog was neutered. So there's going to be people hearing this information who went through that. And that's a difficult thing to live with, knowing that if I hadn't neutered my dog, that probably wouldn't have happened. And similarly, I know vets who really struggle with this. Most vets neuter a dog every day. And if that's your chosen profession out of a love for dogs, and you've been doing this for decades, you've caused a lot of harm. And so there are a lot of dog owners, vets, you know, all of us have just come to we have to come to terms with this new information that is now available. And I think, and I cannot say this strongly enough, we cannot blame ourselves. We did the best we could with the information that was available to us. We must forgive ourselves for past mistakes. I mean, it doesn't make sense, but it's very difficult not to feel guilt about the harm that was caused by us. But we did what we did with the best intentions. There's an American poet, I don't know how to say her name, Maya Angelou, something like that. She said, "We do the best you can until you know better, and then when you know better, do better." It applies to every areas, but it really applies to this one as well. And I think the way we can act constructively with this, let's not look back, let's not blame ourselves for the harm that was done. The discussion is over with this document that has literally come out. Now we know what's best to do. So what we can do constructively is we can really, really spread the news, because the frustrating part is that there will be people who haven't heard. And maybe even in a year from now, there'll be people who haven't heard. And that's hard to live with. So I think we can all make a huge difference in terms of animal health, dog welfare, by talking about this and helping each other just get this information out there. I mean, like I said, I've only just finished reading this document. There's a panel discussion online for vets where the authors are talking about it next week. This is all breaking news, but there will be vets, there'll be lots of, probably most vets haven't read it yet. But we really need to talk about this, spread the information, make everybody who considers neutering a young dog or a puppy stop and think, and just inform themselves.
And I think it's important, listen back to the episodes, because a lot of people are also taught a lot of misinformation, mainly I think with male dogs. They're having trouble training their dog, maybe haven't gone to a dog trainer and exacerbated the problem, and it's reactive apparently, and so on, to other dogs. And then the advice has been neuter them and they will become less reactive. And of course, it doesn't work like that. Oftentimes, and I know I've read the study that's old, very old. It was very old. It was 2005. The study came out on how neutering male dogs can make them aggressive or reactive because of the lack of information from the pituitary gland and the lack of a means for the LH hormone to be processed properly in the body. I don't know. But that was a paper of 2005 that rocked the dog behavior world, because it was considered a male bull breed, chop them off. In fact, that can actually make things worse.
Sure, and they discussed that in this document as well. There is some evidence. What they're really saying about behavior is that it is complex, but they're certainly saying you should never go straight to neutering a dog, surgically neutering a dog, because of behavioral issues. You should contact someone for behavioral help, a dog trainer or a dog behaviorist. And if that's not enough, then you could try chemical castration. But you should never, like I said, they say it's complex, but that you should never move straight to castration if you have a behavioral issue. And they are also, as you mentioned, saying that there is some evidence that reactivity and barking and owner aggression in dogs can be made worse by neutering in male and female dogs.
And females. Gosh, I didn't know that. Gosh.
Yeah.
Would you say female dogs come out worse in this report? I mean, in terms of worse, more ill health can occur to females after spaying than to males after neutering?
Possibly. I'm not, I'd have to read it again in great detail. But there is certainly, I mean, the really interesting thing is that what they keep saying over and over again is that for each individual dog, this will have to be, you have to look at the individual dog, the individual circumstances, and reach the best conclusion for each individual dog. And there are a lot of factors to consider. Like you say, is it a male or a female? But also some breeds have higher risks of certain diseases to begin with. So it becomes more risky once you start increasing that risk. It certainly looks like larger dogs and giant dogs suffer more from neutering. So it's quite clear from this report, as I read it, that small dogs, in many cases, it's less of a problem if you neuter. I'm not saying just go ahead and neuter small dogs, but they can repeatedly warn, particularly against neutering large dogs and giant breed dogs. And when you look at all these different factors that have to be considered, you know, the size of the dog, the breed of the dog, the household, the lifestyle, etc., there's actually one factor that they focus on as the main one when a vet needs to advise in each situation about whether or not this dog should be neutered. And I mean, I was very, very impressed by this, but also quite surprised by this. Shall I tell you what they name as the one most important factor when making this decision? Should your dog be, when they obviously they're writing this to vets, and they are, you know, the one thing you should really consider, and that is, they call it RPO. And they have a table of recommendations. They say if you've got RPO, if you've got no RPO.
What's RPO?
RPO means responsible pet owner. And that's the main factor, because they are saying you have to look at the whole pictures, and there will be situations where, even if it is detrimental to the individual dog's health, you know, even if the risk of that dog getting cancer or any of the other diseases that we haven't even talked about yet, it is significantly increased, it may still be the best thing to do. If you have a dog owner who can't, you know, who's not able to keep an intact dog, or not able to, monitor their dogs properly. So what they're saying is, if you have RPO, if you have a responsible pet owner, then in most cases, the recommendation should be not to neuter. Male and female dogs.
That's interesting. No, that's interesting.
Isn't that interesting? Isn't that interesting that you can look at all the disease risks? You can say some breeds, the risk, you know, neutering a Rottweiler, really problematic, neutering a Whistler, really problematic. But actually they're saying more than breed, more than size of dog, more than how is this household put together, how many dogs are living together, etc., etc. The overriding factor that should determine your advice as the vet is whether or not you think this is a responsible pet owner. And if you think that they are a responsible pet owner, then you're in most cases, to stay with their exact quote, would be to recommend that they don't intervene, that they don't neuter. So obviously what they mean by that, they describe what they mean by that, which is that if you have a female dog, what is meant by responsible pet owner? You know, what they mean is you need a pet owner who is able to manage a female in heat. There's two things really that you should consider when you're deciding whether they're responsible or not. They need to be able to manage a female in heat. They need to be able to make sure that she doesn't escape, that she doesn't mate, that she doesn't run out of, you know, they can't let her loose in a dog park. They can't just, you need to be able to look after a female in heat and stop her from mating.
Yes, but let's face it, Lise, that's not awfully hard. I mean,
no, absolutely. Thank you for saying that. I couldn't agree more.
No, I mean,
can I just say, because they mentioned two things. So to be a responsible pet owner, you need to be able to manage a female in heat. That's one. And two, you need to watch out for the one thing in terms of dog health that is the one risk that is heightened with being intact, is that there probably is an increased, I hear this still being debated, but it sounds like it still is believed to be the case that there is an increased risk of mammary tumors, breast tumors. But the thing about breast tumors is that they are easy to spot. So what they say constitutes a responsible pet owner is someone who can have a female in heat and not let them mate. That's one. And the other is someone who, when they tickle their dog's tummy, just notice if there are lumps in their breasts. And if there are lumps in their breasts, they go and have them examined. If as a vet you believe that the owner of a female puppy can do those two things, keep an eye on their breast tissue when they're, you know, grooming them or stroking them, cuddling them anyway, and manage them for those couple of weeks twice a year when they're on heat, then the scientifically best advice is to not neuter.
Well, this is brilliant. I mean,
it's very, very clear, isn't it?
It seems very, very clear, you know, and
yeah.
Absolutely. Funnily enough, I saw an intact Vizsla today, just this morning on our walk. You know, obviously it was a boy. So yeah, so it was interesting to and I noticed his testicles, and you know, I've seen more intact animals. You can't tell with a girl, obviously, you know, but
sure.
I've seen you know, a lot more boys with their balls, and I think, you know, that's a good thing.
And isn't that going to be exciting in, you know, 5 years to come, 10 years to come, when
Hopefully.
they're all going to be intact? I mean, in 10 years to come, it's going to be the odd one out that isn't. Shall I just quickly what they say about male dogs? Because it's the same thing, the deciding factor. Yes, it's harder on the health of a large breed dog to be neutered, but actually the most important factor is, have you got an RPO? Have you got a responsible pet owner? And if you have a responsible pet owner, then again, they're saying not to neuter. And for male dogs, what constitutes a responsible pet owner? Obviously, they don't actually say that, but I think it goes without saying, they've got to be able to keep them supervised. You know, you can't just let them roam free, but I mean, who does that these days anyway? But what they particularly mention is they need to monitor for testicular disease and prostatic disease. So basically, if the testicles change shape, if they become uneven, if they become lumpy, whatever, you take them to the vet and you have them examined. And they argue that it may be a good idea at the annual health check, just to get the prostate checked, because a benign enlarged prostate is a common problem in older dogs, as it is in older men.
Exactly. Well, exactly, as is breast cancer, I suppose, you know, as well. I mean, it's women on the whole, women haven't got a hysterectomy, you know, I mean, but you know, but yes. I can't bear the thought of talking about things like that, because, you know,
no, but you're absolutely right. This is not sure, but you're absolutely right. This is no different from how we look after our own health. You know, if we get a lump in our breast, then we react. If a female dog gets a lump in her breast, then we react. If a male struggles with the prostatic problems, they're not dangerous, but they can be uncomfortable. Then we do something about it. We go see a doctor. So it's not different. It's just a different way of thinking about these things.
No. I mean, this is brilliant. I mean, it's such groundbreaking news. I can imagine it is putting shockwaves through everything, really. Shockwaves through owners and vets.
There's going to be a before and after in the way we treat dogs in terms of their sex, you know, in terms of neutering. June 2024, right now. That's
tomorrow, going to be everyone. By the way, that is tomorrow.
There's going to be a before and after this document, because it's very, very clear. Another thing they come down on very clearly is this particularly American habit of neutering very, very young, which is, you know, neutering puppies before they are well, sometimes when they're 6, 7, 8 weeks old. I think,
I mean, here it's 6 months. It's the earliest. In England you can spay and neuter, which won't be hopefully for much longer, but it's 6 months is the earliest.
It's the most it varies from country to country, but what they are saying is that early neutering is just a bad idea. And they're even saying, and they discuss at length also the topic of shelters, you know, what to do about shelter dogs, what to do about rehome dogs. And they're saying even in a shelter situation, they understand it's not always possible, but if it is possible, it's best to delay the decision until an owner has been found. And rather than just, you know, blanket do them all. And I think, I mean, it tickles me that this idea that the most important factor is not about the dog, it's about the owner.
Well, yes. Well, you know, there's a lot of talk about introducing, you know, exams before people now take on dogs, so that they do, you know, understand what they have to do with the dog. They understand that a dog is a commitment, not a convenience. Understand that a dog is a dog, and understand how dogs think and how they behave and what they need to do every day and what they don't need to do every day. All of this, I'm really for it, actually. And indeed, to reintroduce the dog license. But I don't know, it can never be policed, because nothing can be policed anymore. We're over, there's too much for everyone to do, at a government level. But I do think certainly, when I was young, hardly anyone had a dog, and there weren't any dog trainers, because people didn't need a dog trainer, because you understood what a dog was and you understood dog behavior and how to be and live around dogs. That was circa 1965. But now, there's a lot more pressure, I think, for people to have a dog. If you haven't got a dog, you're not in with the in crowd anymore, and that's a great worry. So I think a lot of perceptions on dog ownership really needs to be readdressed. You shouldn't be able to buy a dog on the internet, and you shouldn't be able to sell it on the internet. That's my big bugbear at the moment, because that's fueling all these puppy farm puppies, mainly from Ireland, to be smuggled illegally into the UK, and then they're sold on, I call it doggy eBay. And people actually think, Lise, it's normal to buy a puppy with a click now. That sadly became the norm during the pandemic, but it hasn't gone away. So the idea that you might actually physically go to a rescue center and look at the dogs and have an appointment and try and get matched with a dog, that's so much less and less now. And everybody's obsessed with having a puppy, when puppies are extremely difficult. And then very often the relationship doesn't work, because by the time the puppy's won, that owner that bought the puppy on the internet is literally can't cope anymore, and takes it to a shelter. And at the moment, we've got the cost of living crisis and so many other factors that are keeping dogs in shelters. People are afraid now, for lots of reasons, to take a dog on in case they can't afford them. They're expensive to feed. You've got to think about this. So yes, a responsible pet owner, I think, absolutely. But I would argue that the owners that go to the vet, I would say, probably are responsible. But, it's becoming prohibitive, certainly in the UK, pricing wise. At the moment, it's hard to own a dog now. It's a luxury. It's a luxury to have a pet. And maybe that is how it should be, to encourage only responsible pet owners to have dogs. I don't know. Or maybe only the rich can own dogs. I don't know where the future is going to go on that one. I honestly, but I see it, and I know how full the rescue centres are, and they're just getting fuller. So it's sad. And I just hope that this piece of veterinary advice or recommendation, veterinary science, is absorbed and put into practice.
Yeah, and I think I'm more optimistic than you are. I think dog ownership is so much more of a positive thing now than it was even 10 or 15 years ago, with all the positive training and all the new information we have about dog health. But I think what's going to be really interesting in terms of this topic that we're discussing today is that, the repercussions of this are going to be enormous. What this means is that veterinary associations, local councils, welfare organizations are going to have to rewrite their recommendations. Mandatory spay and neuter laws that they have in places, certainly in the US, will need to be revised. This is now the gold standards of what vets should do and say have been written down, and they are, in a way, they're the opposite. I really like this idea that what they define as the main criteria is for being able to keep a dog intact, which is the healthiest state, is it a responsible pet owner? Especially because for ages, again, in America particularly, responsible pet ownership has always been part of the mantra for neutering. And suddenly it's being turned on its head, and they're saying it's best not to neuter, and you can go with that if you have a responsible pet owner. So it's a complete turnaround from what's been said in many places for a long time. And it's going to be really interesting to see, all the discussions in all the different areas that are going to follow from this.
Yes, no, I definitely think it's going to be hugely interesting.
There's a couple of things when I try to sometimes to stay away from social media, because it's Yeah, it's not everyone who has a very strong opinion there knows what they're talking about. But I've been trying to get onto social media and spread this, because this is fact. It's new. It's important. Let's get it out there. And there is, I don't know what it is. Maybe it's just part of being human, but there lots of people respond with an immediate, almost like a gut instinct, that can't be right, or I don't believe that, or that's not what I've heard, and I think that's interesting. I think part of that response is the guilt that many of us will feel because we've neutered. So without even thinking, there is that sort of instinctive, that can't be bad because I did it to my beloved dog, so that mustn't be bad. I'm not prepared to listen to that argument even. And I think to that, it's really important to say, like I said before, now that we know better, we can do better, but we cannot dwell on what we did on the basis of the information we had then. The other comment that I get quite commonly is, well, we did it for our dog and he's much happier, so it was right for us. And that's kind of not getting the whole point. But, I mean, of course, there can be individual situations where it's the best thing to do. Of course, that can. But if you say you have a male dog that's an intact male dog, maybe a teenage intact male dog even, that gets very aroused when there's females in heat. So you've got howling and panting and pacing and maybe waking you up at night, and you've got this restless, sexually frustrated teenager in your house. And you neuter that dog and he lies down and sleeps and is calm. That, if you don't understand dog behavior, and if you don't quite understand the serious implications of neutering that we're talking about here, then that may seem like, well, we surely did the right thing. But if you do that dog, I mean, I hate to sound alarmist, but that dog may die of cancer because you did that. That's what we're talking about. And we didn't, I didn't actually, I mean, the list is almost endless, but the increased risks, and these are being further investigated, and lots of research is still going on, but the increased risks that have been demonstrated in studies are, as I mentioned, several types of cancer. It's what do you call it? A ligament disease, knee cruciate ligament problems in knees. It's osteoarthritis. It is disc problems in dachshunds, how do you say that in English? It's little sausage dogs with bad backs. That is the risk of them suffering with disc disease is increased by neutering. But it doesn't stop there. It is allergies, autoimmune disease, hypothyroidism, inflammatory bowel disease. So when you hear someone say, as I hear all the time, well, I've always neutered my dogs and they've never had any problems. You've got to go back and think, well, did any of them suffer with irritable digestion, a tendency to lose stools, or food sensitivities? That could be because they were neutered. Did any of them suffer from hotspots or recurring ear problems? That could have been because they were neutered. Did they die of cancer? Did they have arthritis in old age? We don't see these connections until we're aware of the possible link, which is how dog owners and vets missed this for so long. So that sort of argument, well, that's never hurt anyone. It doesn't really work. And also, of course, you can't, I mean, the last thing I want to say, then I will shut up, is that this doesn't, of course, mean that anybody listening who has a neutered dog, that they'll definitely die of cancer. We're talking about risk factors, and we're talking about statistics, and statistics can just be really hard to wrap your head around. Obviously, you can have an intact dog that dies of cancer, and you can have a neutered dog that lives to a very high age and never has anything wrong with them. Most of them will. But the relative risk of acquiring a long list of diseases is higher in the neutered dog population. That's
it's great.
statistics.
It's statistics. Absolutely. I've actually studied statistics, Lise. You wouldn't believe it. I had to for my human psychology degree. Absolutely, they're fun to work out. No, I'm joking.
I was going to say, I think it was one of my worst topics at vet school,
it was absolutely
epidemiology,
horrendous.
And it's not often logical, But I mean, what I always think is, just because something carries a higher risk doesn't mean it's going to go wrong. You can blindfold yourself and cross the street at a red light. It hugely increases your risk of getting hit by a car, yes. But still, most people who do it are probably going to be fine. But that doesn't mean you can stand on the other side and say, I did it. It's absolutely safe. Everyone can do it. I mean, it's...
No, absolutely. This just backs up the previous episodes that we've done. So it's great. I'm really proud, very proud to be airing this message. Literally, as of tomorrow, which is the 24th of June, this will be, we can't really say legal, can we? But we can say, what can we say that it is now, this spaying and neutering debate?
Obviously, I was going to say it's landed, but there will be amendments, and there will be research, and there will be little tweaks, etc., as we learn more. But what it is that it is now official that, partly that vets who discuss neutering with dog owners should mention the increased risk of cancers and arthritis and allergies and all these things. If they don't, they really should. That's now clearly stated. This is the minimum standard of care. This is the best practice. You need to warn against these things. That's big. So it's official now. It's all the information is there, and the experts have gone through it, and it's available. And I think it's really exciting. I can't wait to see the next decade. This is a game changer, for sure. This is a really comprehensive piece of work done by some very clever people.
Oh no, good, honestly, good for them. This is what is needed, to be honest, on so many levels. Well, I can't wait to really talk about some of how this all kind of falls out. It would be really interesting.
Going to be a lot, exactly. There's going to be a lot of discussion now. There's going to be a lot of websites that need to be changed, a lot of recommendations that need to be changed, a lot of policies in shelters and associations, and a lot of laws, particularly in America, I think, that need to be changed. And they will be. What we can do, I think the process is inevitable, but what we can all get together to do is speed it up. Spread information and talk about this. That's the important phase now, I think.
Well, I'm glad I've done that bit.
Yeah, thank you.
Thanks, Lise.
Thank you.
And thank you so much for being our WSAVA live correspondent from where it's happening. I appreciate that. So we've done another one on the WSAVA quite recently, which was indeed about their vaccination guidelines, which is also worth paying attention to, I would say. And just I want to say thank you, WSAVA, from the bottom of my heart.
Thank you.
That's our show, Mr. Binks. What did you think? Oh no, don't look at me like that. I know you had them chopped off, but that was before you came to live with me. And you're right, it is time for Woof of the Week. When we've been proud to be the first podcast to discuss the new WSAVA guidelines on the dangers of spaying and neutering. Well, I hope you all enjoyed it. If you did, go on, please rate and review the show wherever you tune into your podcasts. It really does make a difference. Thanks again, of course, to Dr. Lise Hansen for joining us again today for what is an amazing addition to our series of podcasts on the issue of spaying and neutering. Thanks, of course, to Mike Hansen, my producer, for all the music and production as ever. Oh yes, Mr. Binks, you're right. We will be back in your feed next Sunday. So why don't you subscribe now? It's free and you'll never miss another show. And we've got a very, very hot subject coming up next week too. So be sure to tune in. Bye for now.